Yeah, I'll just leave some of my did bring notes. I don't have any fun things to show dealing with medication. They generally frown upon me giving those out. So it was nice to see. Oh, thanks. Yeah, it was great to see all of those things. And as passionate as she was with her mobility and stability, I would have to say I feel the same about medications. So, being a pharmacist for 27 years and dealing a lot with medications, it is near and dear to my heart. So, as you've heard a lot this morning, I'm sure, we know that arthritis affects millions of people. You hear either loved ones or yourselves. So, the good news is that there's a lot of ways that we can manage it. I'm going to be talking about a lot of those today, kind of a comprehensive approach on the therapeutic side, so to speak. So we're going to be talking about medications, supplements, nutritions, some lifestyle modifications, and then just very briefly, just surgical options, because there are sometimes comes a time, and I believe we already had someone here that had said they had had a knee replacement or something. So we get to those places where sometimes the therapeutic or the medications may not always work. When it comes to treating arthritis, medications are a key part to treatment, usually, if not the very starting point for where doctors will start us when we have arthritis. But they fall into several categories, and they each kind of serve a specific purpose. Um, the first and foremost, I think probably the hallmark that you all have heard about are the non-steroidal anti-inflammatories. Those are the NSAIDs. Those are medications that you can get readily over the counter, such as ibuprofen, we hear Motrin, naproxen, which is like Aleve. These are used to reduce pain and inflammation. The really good thing about the NSAIDs is they're fast acting. These are something that generally when you take it, you're going to feel relief, or we hope that you feel relief, in 20 minutes to a half an hour. Um, Along with that comes some side effects. So we have to think about all of the options that we're going to be talking about. You're going to be weighing your benefits and your risks for the medication. So with the NSAIDs, the benefit is you have quick acting, we're decreasing inflammation, and we're reducing our pain. Things we've got to think about side effect wise are generally our stomach issues. You hear the doctors talk about the GI, your, nausea, your vomiting, your diarrhea. So different ways we can combat that is when we take our medications, you can take them with food to help alleviate some of those things. And doctors will not so much with the NSAIDs, but sometimes we have to watch different, blood count levels, and they'll take initiating blood work first before you start medications to make sure that it's a fit for you. The next group is I don't want to say newer, they've been around for a long time, but they're becoming much more popular for indications like arthritis. They are called DMARDs, and they are disease modifying anti-rheumatic drugs, which is a long word. That's why everybody kind of nicknames them the DMARDs. What is very interesting about these is they are specifically designed to treat autoimmune and inflammation conditions. So what that means is they work by slowing or stopping the progression of the disease by actually suppressing your immune system. So the difference here with these medications, the ones that I'm talking about right here, we'll get into some other ones. These are actually oral medications that can be taken. The difference here is that these take weeks to months to show their full progress in your disease state. And sometimes that can be a difficult thing for a patient. We're used to the NSAIDs. We're used to taking a pill and seeing some relief in 20 minutes or half an hour. Convincing someone that you're going to have to be, stick with this for, weeks to months before you're going to really see, the benefits can be a difficult thing. So that's why the explanation, the theory behind it is very important for patients. You need to understand what you're on and why you're on it, and that if you will see benefits, later to come, to kind of will give you that will to maybe, to stick with it. Things to expect when you're on medications like this. The normal, we have our stomach, our GI. It's going to be you're going to hear that reoccurring here as I go through my slides. We're going to always have our, nausea, our diarrhea, our vomiting potentially. But because these are dealing with our immune system, these actually are working by suppressing your immune system. So we have to watch a few other things. We have to know that perhaps infections can start to happen because your immune system is not going to be top notch, because we're doing that on purpose to make sure that your arthritis is kept at bay. They can deal with and kind of, tap into your different cell counts. So we have to watch. Doctors, you'll see when you're on medications like this, there'll be periodic blood work that is done consistently to make sure that none of those levels are going too crazy that they need to adjust doses, to medications. I think we'll go in now to the second set of these DMARDs. There's now not just the oral ones, there's ones that are called biologic DMARDs. So these are actually targeting, again, your autoimmune system, but there's specific proteins and immune cells that these are targeting to help with that arthritis condition that you have. They are not taken orally. These are either injected or infused. So these pose a little bit of a different challenge in receiving your medications. These aren't as easy to just, stop down at Giant Eagle or any of your other, pharmacies to get your medications. These are typically done, at your doctor's setting, or, having someone perhaps come to the home to do those. So they pose a little bit of a challenge there sometimes for patients. These also are dealing, as I said, with your immune system. So our side effects are going to be similar to the oral ones, but then we also have to watch for any type of injection-related adverse events. If anybody would have an allergy to something like that, any problem with the actual site of where it is infused or injected. The next group that I'm sure a lot of you, those of you that either have loved ones with arthritis or are dealing with it yourself, are used to hearing about, are corticosteroids. These are medications that are dealing with decreasing the inflammation with arthritis. They are also suppressing the immune system. So these are used to provide pretty fast-acting relief due to the inflammation, but also the oral corticosteroids are not used long-term typically. So these are often used if you hear somebody that has a flare, or they're having a really tough time initially with arthritis, or an accident maybe has happened that caused a flare-up. And there's a couple reasons behind that. Again, we're dealing with the immune system, so we're going to be suppressing that, so we have to watch for infections. But corticosteroids have a whole other host of things that they can cause. They can have issues with blood pressure, and they can have issue with patients' glucose. So a lot of times, once we have arthritis, there are maybe some other health issues that our patients are dealing with, and they may have some cardiovascular, some heart issues. They may have diabetes or pre-diabetes. And adding on a medication that may help their arthritis, we also don't want to potentiate problems with something else that's going on. So that's a lot of times why the corticosteroids orally are used short term. You'll hear, the doctors will kind of give you, and it's one of those drugs that often is a taper. So you'll take it, 3 times a day for 3 days, then you go down to 2 times a day for a few days, and they kind of taper you off so that the effects that it has on the other systems in your body doesn't potentiate any other problems for you if you're dealing with any other conditions other than just arthritis. Corticosteroids, I can't go without saying, I'm sure some of you in here have had it. Typically given orally, like I said, short term, but they also are given as a shot directly into the joint. So those intra-articular shots that you may have heard of or experienced yourselves. And I wanted to take a second to talk about those shots, because I find that patients get a ton of relief from them. They're directly into your joint. These don't have the same systemic effects necessarily that the oral medications do, just because they're a little more localized. Patients will see an increase in, sometimes blood pressure and glucose along the way, but not nearly to the effect of the oral medications. But those intra-articular shots can be so useful, and many different medications can be given that way. So everybody hears your cortisone shot. I think, if you had friends or you've talked to people, that's a very common one to hear. But for arthritis, there's a lot of other medications that can be injected directly into the joint. There's medications that can be injected for just lubrication, so to relieve that stiffness, hopefully get those joints moving. There's medications that can be injected that actually can potentiate and help growth, rebuilding cartilage. There's more than just the anti-inflammatory aspect of the cortisone. There's many different types of injections that can be given, depending on each individual, of course, patients, where they are in their treatment and what other disease states they have. But it's a very unique and targeted way to deal if you're having a specific joint that is the problem that can be help in solving it. This next slide is again all things that I think that you have heard, but these are much easier to attain. And I talked about the NSAIDs, where we talked about having quick acting pain relief option. The NSAIDs had the help with inflammation with it. Analgesics, these are our pain relievers only. So these are our Tylenols. You can, over-the-counter Tylenol. There's also some prescription medications that can deal as just analgesics, but these are maintaining your pain without any help with inflammation. So what we see analgesics used for most often is in combination. We can add these on to a lot of other things, so you can combat hopefully getting some relief from your inflammation, which will help your arthritis, along with some extra pain relief through just the analgesic. Things to expect with side effects for your analgesics, gonna be the same as we've talked about. You'll always have to watch your stomach. That seems to be our, reoccurring theme here. So you're gonna wanna take these with, again, your meals, with some food, and make sure that you protect that GI system. We have some topical treatments, just like where I was talking about those intra-articular shots can really focus on just one joint and dealing with some localized pain there. Topical treatments can do that. These are our creams that you see, your Bengay, your capsaicin. We have the diclofenac gels. This is going to be for localized joint pain. Again, what is really good about these is that you can get some pain relief and maybe some help with localized inflammation, but because they're not systemically absorbed, we don't have as much interaction with other medications and things that someone may be taking. So it's a great avenue if you have one joint that might be bothering you. Kind of hard. I mean, I guess you could, but kind of hard when you got to slather it all over, and but we have people that do. But it's really great for localized and very specific treatment places. And I put on this last one because I do believe one of the physicians probably spoke about it earlier, but with gout arthritis. And this one is near and dear to my heart. I had a patient when I was a retail pharmacist that came in that just suffered from this tremendously. And I could see the pain. I could see he needed, different things to help him walk when he was having certainly a flare. And so seeing those, canes and different things, and you just really feel for somebody because you can tell the pain that they're having. There are some specific medications for gout. Gout deals with the uric acid levels in the body, and there's medications that can cut that down to create and alleviate gout for someone that is having gout arthritis. So I just like to put that in there to know it's a little more specific, but there are specific medications that can target specific conditions like that. So supplements are also play a very supportive role with lots of different indications, especially arthritis. They can help reduce inflammation. They can also help with stiffness and joint mobility. I think two of the most common that you may have already heard of and see are glucosamine and chondroitin. These actually help maintain cartilage and slow down that joint deterioration. You'll see it most often in combination. You can get each supplement separate, but then they also come in combination because they work so synergistically together. And then there are two underneath there, MSM and that CME. Those are also often added in to tablet formations and different things that you can just buy over the counter. Again, those are supplements all geared towards maintaining cartilage. Some will claim about helping rebuild. I think often it's good to think of you want to maintain what you have. You want to make strong what you have. So taking these supplements is going to just keep that steady state and help continue to decrease that inflammation, keep that cartilage good, and help hopefully with that lubrication, giving that fluidity in your joints. Which brings me to the next one, the omega fatty acids. We all hear about fish oil. You read about fish oil for just about everything. There's heart health, there's your mental health, and now, right? And now for your joint health, it's the same type of idea. This helps reduce inflammation. That's the omega fatty acids claim to fame. They're, the anti-inflammatory properties are fantastic for multiple things. So it is a supplement. If you're going to add, you can get a nice big bang for your buck. You're going to be helping, all different sorts of body parts when you take your omega fatty acids. Unfortunately, a day like today in Western PA, we're not getting much of our next one. That vitamin D is very important for many things. We all know, from the sunshine, that's where we get our vitamin D, but you can take that as a supplement also. Vitamin D is huge in immune function and bone health. You can take it with calcium. That's extremely important. They help each other, in the body, so to speak. They're helping hands. They come in combo, vitamin D and calcium. But vitamin D is shown for sure to help. So helping in that immune function, you're helping with the inflammation, helping in your bone health, creating that stability in those joints that you hear about. That's so important. Last main supplement that I'd say is, really for arthritis is that curcumin or turmeric. You hear it said all different ways. That is very common in really focusing in on that inflammation aspect of arthritis. So you're going to be decreasing that inflammation, which in turn hopefully is going to decrease your pain that you're seeing. Can't start with supplements and not go into nutrition. I think that, again, nutrition plays a powerful role, not just in managing arthritis, but in, many aspects of health for all of us. We know that nutrition is not going to cure arthritis or, any other true indication, but it can make a significant difference. And what to think about when we're talking about nutrition, how I kind of always look at it, is there's always foods that you should eat, and there's always foods that you shouldn't eat. And I think that's, with anything that we're doing. In talking about arthritis, we're going to focus on that key word of inflammation. That's kind of what is, constantly happening when you have this condition. So there are foods that we can focus on that are going to decrease that inflammation and hopefully help decrease your pain and your stiffness. And things we're going to be looking for. We just talked about it. Those fatty acids. We said how important that was to decrease that stiffness, to help those joints, that fluidity. So we're going to look at things that are going to really contain the fatty acids. And those are our fish, fatty fish that they say. So salmon, mackerel, things that are high in the omega-3s are going to be very beneficial to decreasing that inflammation for our patients that have arthritis. You hear it all the time. Fruits and veggies. Fruits and veggies, you really can't go wrong. Here is going to be our green leafy veggies. We hear it all the time. The fruits specifically we're going to talk about are kind of berries. Berries are very high in antioxidants. Antioxidants are, just huge in a way of protecting your joints. So think of joint protection, those antioxidants. And if you're a berry lover, then you're in luck, because those are the best ones to get. Our nuts and seeds, we have found walnuts to be a great nut to help reduce inflammation. Again, if we're going to talk about some oils, you're going to want to pick the best oil that you can. Olive oil would be a higher choice up there just because it has some of the healthy monounsaturated fats in it, as opposed to some of our, vegetable canola oil. choices. If your lifestyle allows grains, I know there's, other things that we have to watch with those, but if we have a choice, let's go with our whole grains versus anything that, has a refined grain. So, look for those brown rice um, type of whole grains instead of using our refined ones. And tea drinkers, anybody that likes tea, if you'd want to switch to, that's me. I am a big tea drinker. But green tea has the polyphenols in it. And those are actually have been found, and they're being studied even more. I read a lot about it for their anti-inflammatory properties. So if you're a tea drinker and you want to switch a little bit to that green tea, you're going to be getting even the more beneficial things for decreasing your inflammation for arthritis. And now we come to the sad part. What do we got to avoid? What do we have to avoid? I don't think it's going to be any big surprise. These are kind of all very, very logical. But we gotta avoid all of our processed and our fried foods. Sometimes it's hard. I know we all like to stop at the McDonald's once in a while. Those fries still get me. I have 4 kids, so I do make my trips through some drive-throughs often, guys. But we know that those just kind of make sense. Those are going to increase, the inflammation and can cause a little bit, be one of those triggers for maybe a arthritis event. We're going to want to watch our sugary drinks, our refined carbohydrates. Not only do these contribute to weight gain, which obviously is going to put more stress on our joints and whatnot, it's going to increase our inflammation. An overabundance of red meat and processed meat can be linked to inflammation. So, your occasional steak, things like that, not that big a deal, but it's for, the overconsumption of it that, you can really start to see the increase in the inflammation. Excessive alcohol. We see that actually triggers flares. I was talking about using the corticosteroids as a, kind of the oral ones as a one-time when you see that flare. Excessive alcohol can be one of those triggers. And I'm not talking about our glass of wine at night before we go to bed. We're talking about excessive use. And our high sodium foods, all the salt intake, having all of that extra salt, can create extra water retention and then causes our joints to swell, which of course, having that inflammation, as we have talked about, can really cause some problems. So really, in short, with our foods that we want to focus on to decrease our inflammation and our foods to avoid, it's really eating a well-balanced diet, and that's what is going to support our overall health, but also helps ease arthritis. And we want to keep you moving. That's our goal, is to keep, you want to eat right to keep yourselves moving. So some lifestyle modifications. This is another approach, and they actually can offer a really powerful tool and help with relief and also like long-term joint health, I would say. And of course, they include weight management. Maintaining a healthy weight clearly reduces stress on the weight-bearing joints, which in turn decreases our pain that you would be seeing. And weight management, as we talked about with the other medications and different things, weight management is important for many different areas, of health and wellness. So having it just be kind of top and forefront is going to not only be helpful to decrease your pain for arthritis, but also those other things that often go along with as we get older with arthritis and different things, our diabetes and our heart health. So it's just a kind of an all-over comprehensive area that you'd want to, focus on. Regular exercise. These are low impact type exercise. I would say important for arthritis. We're going to look at, walking, maybe swimming, being able to engage in some of those activities. They strengthen our muscles and improves our flexibility. And reduces stiffness in the joints, all very important for, arthritis. Oh, the healthy diet, had to stick that in there, even though I know we spent 2 slides on it, but we want to make sure that we focus on all the right things for our body. Joint protection. We just talked about a lot of the mobility. I do believe we're going to have physical therapy. We'll be talking, so we'll be giving you lots of good advice on, joint protection, but to use those devices. There's lots of things out there that can really help with stability, help with, your joints, talk to the experts in those fields to do what is best for you so you don't risk injury or anything while you're, at home and keeping yourself active. I always put stress management and adequate sleep together. I feel that not only do reducing these and make sure you reduce your stress and getting enough sleep can reduce that inflammation for arthritis, but they also can improve your pain perceptions. So, being less stressful, being, sleeping well, you'll be able to, one, deal with your pain a little bit better and hopefully decrease that pain. And it also promotes just an overall, more positive outlook. So when you're feeling better, you're less stressed, you're sleeping well, you have the positive outlook to help perhaps do some of these other lifestyle modifications and make the best choices. The really small, consistent changes can truly add up and just take you step by step into taking a little bit of a healthier journey. So for individuals with severe arthritis that maybe haven't found relief through the other things that we've talked about, sometimes surgery is an option. They can include joint replacement. They can include procedures where you remove inflamed lining. You can remove fluid. If there's debris and stuff in the fluid that's causing friction, there's procedures that can do that. And I would say surgery is typically a last resort, or they look at it towards the end of different treatments. But I also like people to remember that it can greatly improve your quality of life. I think sometimes when people think about getting surgery or they're talking about a joint replacement, it's almost like they have, like that's the last thing I gotta, surgery is my last thing that I couldn't do medicine, that didn't work, But I don't think that that's everybody's condition is different, and sometimes having that is the best for you for your quality of life. So I don't like to ever think of it as like saying it's the last resort, you're going to get surgery. Obviously, put your body through more stuff, but sometimes your quality of life can be greatly improved. And so I don't like anybody to ever think about as that as being, you've hit the last thing. Remember that quality of life is important. So really, in the end, managing arthritis is about finding your piece to your arthritis puzzle, finding what works for you. It can be a lifelong condition, but it doesn't have to really control your life. So remember that finding your right combination, whether it's medication and supplements, some of these lifestyle modifications, or even going the route of surgery, that the most important thing is improving your quality of life and taking back your control and keeping yourself active and moving. I think that is really, really our goal. And so I'll be happy to answer any questions if anybody has any, or I'll be ready. Sir. Yes. So all good questions, and being a retail pharmacist, that's I completely understand. So two things. First, yes, your retail pharmacist will be extremely knowledgeable about the medications. Things to consider though, remember what medication you're asking them about. There's some of these are, infused medications, things that aren't given or, normally at a retail pharmacy. So those may not be as quick, knowledgeable as the oral medications that you're getting. So any prescription that you're getting from the retail pharmacist, they'll be very, very educated to be able to talk about. And anything, if it's a super specific question, we have all the resources to get you the answers that you would need. So first and foremost, don't ever hesitate to ask them questions about your medications. Second, for the time. I wish I had a fantastic answer for that. Retail pharmacists are busy, but honestly, I can tell you for sure, 100% of the time, they would much rather come and answer a question for you than worry about, everything that's going on behind there. So if you have a specific question, if you know you have a specific question, maybe calling and letting them know you're going to come in this afternoon, is always helpful. But, being there, that's our job. That's our love. We want to be able to talk to patients. You know, that's what we did all of our schooling for. That was our education. Unfortunately, you know, paying the bills is filling the prescription. So, you know, we have to do that also. But don't let the look of busyness ever hinder you from really asking the questions that you have, for sure. Yeah. I will say it's often store specific, you know, so depending on, you know, what your pharmacist, you know, or where your pharmacy is, some pharmacies are staffed a little bit differently. You know, there are some that have several pharmacists on duty at one time versus some that only have one pharmacist. When you're only one pharmacist, sometimes it's a little more difficult because, you know, you get pulled in different directions. So if it's a larger one, you'll often have a little bit of an easier time talking to a pharmacist because there's one that's dedicated more just to questions, you know, and answering, you know, doctor phone call questions and also patient questions. So that's kind of a, you know, kind of a hard one because it does vary, but I'll say, especially in our area in Pittsburgh, it's busy. I mean, I love it. It's great, and we appreciate everybody that comes. But sometimes for the things that we enjoy doing the most, it can be a little difficult. Anybody else? Well, then, thank you so much for your time. Oh, you're welcome. All right, we're hanging in there.